Let's walk through a quick scenario where cultural humility helps us slow down in practice.
Applied case simulation, cultural competence and diagnosis. You are a behavior analyst working with a 3-year-old child and their family. During intake, the caregiver reports that the child sleeps in the same bed or on shared futons with caregivers each night. The caregiver explains that this practice, often referred to as soine, is common and culturally meaningful in their family and community, reflecting values of closeness, interdependence, and emotional security. A previous provider documented concerns about sleep dependence and suggested immediate independent sleep training as a treatment priority. The family appears hesitant and expresses discomfort with recommendations that would eliminate co-sleeping entirely. Understanding the cultural context. Soine is a traditional co-sleeping practice common in Japanese and other East Asian cultures. It reflects deeply held cultural values, including interdependence, family cohesion, and the importance of physical closeness in child development. In many cultures, co-sleeping is not only normative, but considered essential for emotional security and healthy attachment. Research shows that co-sleeping practices vary widely across cultures, and what is considered developmentally appropriate differs based on cultural context. The Western emphasis on early independence and separate sleeping arrangements is not universal and should not be imposed as the only acceptable standard. Analyzing the previous provider's approach. The previous provider's recommendation demonstrates several problematic assumptions. First, it pathologizes a culturally normative practice by labeling it as sleep dependence. Second, it prioritizes Western developmental norms without considering the family's cultural values. Third, it creates an unnecessary conflict between treatment and cultural identity. This approach risks damaging the therapeutic relationship, reducing family engagement, and imposing interventions that may be culturally inappropriate and potentially harmful to the family's sense of identity and community connection. Culturally competent assessment framework. A culturally competent assessment begins with understanding the family's perspective. Ask open-ended questions about their sleep practices, the meaning these practices hold, and any concerns they may have. Avoid making assumptions based on Western norms. Assess whether the current sleeping arrangement is causing any actual functional impairment for the child or family. Is the child experiencing sleep disruption, behavioral challenges, or developmental delays that are directly related to the sleeping arrangement? Or is this simply a cultural difference? Consider the family's goals and values. What outcomes are important to them? Are there specific concerns they want to address? The assessment should be collaborative, respecting the family's expertise about their own culture and circumstances. Developing culturally responsive interventions. If intervention is needed, it should be developed collaboratively with the family and respect their cultural values. Rather than eliminating co-sleeping, focus on addressing any specific functional concerns while maintaining cultural practices. For example, if there are safety concerns, discuss safe co-sleeping practices. If the family has concerns about future transitions, develop a gradual plan that aligns with their timeline and values. If behavioral issues exist, address those specifically without assuming co-sleeping is the cause. Always provide families with choices and involve them in decision-making. Interventions should enhance family functioning and child development within their cultural context, not impose external values. Key takeaways for behavior analysts. Cultural competence requires ongoing self-reflection and humility. Recognize that your own cultural background shapes your assumptions about what is normal or appropriate. Question whether a behavior is truly problematic or simply different from your cultural norms. Build genuine partnerships with families by valuing their cultural knowledge and lived experience. Seek to understand before seeking to change. When cultural practices differ from your training, consult with cultural informants, seek supervision, and engage in continued learning. Remember that ethical practice requires us to respect client dignity, autonomy, and cultural identity. Our role is to support families in achieving their goals within their cultural context, not to impose our own values or Western-centric developmental models. Thank you for engaging with this case simulation on cultural competence in diagnosis. Remember, every individual and every situation is different. This video is for educational purposes only.